So I think we're good. Tube is secure, release ties, volatile's on. We've got those 2 cannulas working. We both gave the tranexamic acid. Blood, I think, is on the way, but we can cover that when we do timeout, which I think is now is a good time to do a timeout.
If you're happy from anaesthetic
I am.
side, Martha, can you run through the timeout for us, please?
Yep. All team members have introduced themselves by name and role.
Yes.
Okay. Confirm the patient's name and CRN.
Yeah, we have Claire Jackson, 23rd of the 3rd, 94, and hospital number is 351-422-1307.
Okay, and confirm procedure, consent and position planned.
Yep, so we'll do an examination under anaesthetic. We've taken verbal consent because this is a major hemorrhage.
Okay. Additional procedures planned.
So we may have to put in a back balloon. Last resort, we may have to do a laparotomy.
And any critical and unusual steps you want the team to know about?
Obviously the blood loss, we've got blood on the way, major hemorrhage protocol is activated, consultant is on the way.
I think we estimated we were about 1,500 mils when we left the room. And can I clarify, Andrea or Kate, did you manage to speak to blood bank? Has someone told you the blood is definitely on the way?
Yes, we've activated major hemorrhage protocol, so they'll be on doing it now.
And they're going to let us know when the blood's ready to collect. They're going to ring us in theatre. Excellent. Sorry.
Are there any concerns about the placenta?
It is out and it is complete.
Okay. Anaesthetist, any specific concerns?
No specific concerns. She's not got any allergies. The one thing I haven't done is given her antibiotics. Would you like some antibiotic prophylaxis?
Yes, please. Could we have comoxiclab? Thank you.
Zoe, would you mind after this is finished getting me some augmentin 1.2 grams? Thank you.
Okay. Script practitioner, instruments are sterile.
Everything's counted for and sterile.
I'm so sorry.
I think it's because you were moving that, so it's come out. Possibly.
It's because of this.
Continue. Any equipment issues or concerns?
No concerns.
Okay. That's timeout completed.
Super. Did we get in touch with Dr. Brown?
Yeah, she's on her way.
Oh, lovely. Okay.
I don't think she'll be too long, actually.
That's fine. I'm going to just let someone look. Oh, hello. Hi, Jen. So we've got a major hemorrhage here. Normal delivery at 7 o'clock. Placenta's delivered and complete. Uterus was atonic initially, so we have emptied the bladder. We've given ergometrin. We've given a syntocinon infusion. We've given 1 dose of carboprost. That has helped, but we've still got some ongoing bleeding. I didn't get a chance to examine properly for tears because the patient had no analgesia. We've been resuscitating with fluids. Blood is on the way. Sarah is happy-ish.
Yeah, so she's had so far in total, she's had 2 litres of crystalloids. We've given her some tranexamic acid 1 gram. I'm told that the major hemorrhage protocol has been activated and we're en route with our first 2 units.
Brilliant.
My plan was to get started with those. I'm not going to do a hemo-Q at this present moment because I feel like, in view of her clinical status and what we've lost, that we can then recheck after the first 2 units and see where we're at.
All right, well, that's uterus is well contracted whilst I'm doing manual compression.
You continue doing that, I'll go get some.
Thank you. Okay, so we're all set up and ready to go.
Ready to go.
Excellent. Okay, I'm just going to stay like this for now until Jen's.
What do you think might be causing it, Heather?
Well, I mean, so let's have a think. So we know it's not any retained tissue, so check the placenta, it's definitely complete. The uterus was quite atonic, but we've given management for that, and right now it feels quite firm. Obviously, clotting factors, we need to wait for those to come back from the lab. I guess there could be some trauma. I just didn't get a good look in the room because she was bleeding
Was
quite
it
a
big
lot.
baby? I didn't even pay attention.
I'm not sure if they've even been on the scales yet.
Oh, no,
No, we haven't weighed baby.
So maybe
yet.
some trauma.
Possibly, yeah. So I'm just going to let you. Okay, all right. I think, I mean, I didn't get a chance to look, but it looks like there might be a bit of a tear. No problem. We've got a count and everything all in the yeah, we're all ready to go. So I'm just going to repair to try. Just going to examine. Well, the cavity's definitely empty now. Yeah. Actually, the uterus is starting to feel quite well contracted. Yeah, good. But there is still an ongoing bleeding. Can I have a sim speculum, please? Thank you very much. And have we got a pair of collet forceps, please? And I'll need a swab as well, please. Thank you very much.
So I'm just going to check the cervix, make sure there's no cervical injury.
Did you get me some morphine, Zoe? That's one thing I didn't.
No, that looks absolutely fine, but I can see there's quite a decent vaginal tear. Have you got a suture there? Thank you very much. Okay, so I'm just going to repair this tear.
Thank you. I'm touching you.
Oh yeah, that looks to be getting it, doesn't it?
Yeah.
Oh, super.
Do you think this could be the culprit?
Yeah, I think so.
Things are looking a lot better now. Yeah, that's all set. Just another swab, please.
All looks like it's settling down there.
Excellent.
I'm just going to check
How's
there.
patient doing?
So a bit on blood pressure, a little bit on the low side. We've got a systolic of about 90, but she's young and fit. The tachycardia is definitely on its way down. I suspect maybe if we give the 2 units of blood, recheck the hemocue, see where we're at, and that may well be enough.
Yeah, sure.
So Kate, do you think we can keep her on labour ward in a high dependency room to observe initially? And we'll do 15-minute ops for the first hour anyway.
And when do you want a CPC next?
So if we do it, we'll do it. Zoe and I will do a hemocue before we wake her up, and then if we do, we need to, because she'll have had the 2 units of blood by then. If we do a full blood count and clotting, we may as well do a UNE as well in 4 hours, and then see where we're at.
Right.
I think obviously if we have any clinical changes, we can revisit that. Sure. Does that sound okay to everybody?
Yeah, brilliant. And things are looking much better there now, so that all seems fine. Should I get the lace down?
Are you happy if we stand down the major hemorrhage protocol?
Yes.
Sounds like a good idea.
Yeah, I can ring it up.
Good. Thank you.